Welcome, Dr. Rahul. Today also cancelled. No, 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 Dr. Saab. We cancelled on that day just because you have been aggressively taught by madam, so we thought to relax you. So we'll enjoy the psychiatry, and trust me that we'll enjoy the whole of psychiatry. And okay, yeah. So all done. So let's do the first question. That and we try to club up the this knowledge of psychiatry as well as the previous year's MCQ so that you're all at the up to date mark with the subject. So someone saying that my daughter wants to kill me. If it is not a reality, it is a Ram Ram ji, Akshat ji, and Dr. Welcome, Dr. Ria, Rockstar. Good evening. So please mark the answer. It is a well. नहीं नहीं डॉक्टर साहब ये नहीं है सदफ खान जी वेलकम फैक्टर इंसेन डॉक्टर हाँ डिल्यूजन है यही है सॉरी सो डिल्यूजन वी ऑल नो it's a fixed belief. Delusion is a disorder of thought. Disorder of thought, and it's a fixed belief, firm belief, fixed, firm, false belief, held with undue conviction. That is what is being called as the and not shared by others. और लोग ऐसा नहीं मानते हैं and not matching with reality is being called as the delusion. That's why you have to give me 1 minute because the pen is not working. So some glitch always happen. Oh my god. I'm so sorry for that. भैया मैं सुबह ले लूंगा आपसे. Back? Yeah. So we'll do the questions. If at all we are not able to write, hopefully we'll be able to connect and write. All done. So let's do the first question. And we try to club up the तो आप लोग हैं डॉक्टर साहब चले गए.
हेलो.
हाँ जी दोस्त चल रहे हैं अब.
हाँ सर, क्या हो गया?
नहीं वो बीच में ना मेरा ये पेन नहीं चल रहा था. तो आप देखिए लाइव लाइव है. देखिए होपफुली ठीक हो जाना चाहिए.
अच्छा.
आप लाइव इज गोइंग ऑन.
हाँ, लाइव तो अभी है.
ठीक है. इट इज डन नाउ. वी कैन स्टार्ट. नो प्रॉब्लम. Yeah, sorry, and once again, thank you for joining with us and bearing with us. So we now come to the next question, and I just would like to remind you of the many MCQs here. The special type of delusions we say, the we must know the simple name like Othello syndrome, Capgras syndrome. Are you there? Okay, all right. Fixed belief. Yeah, we are on the track. Yes, sir, Dr. Sam. Now able to see you. So we have the Capgras syndrome. I'm just writing it for your clarity. Othello's, Capgras. We have the Cotard syndrome. They are all lollipop MCQs. We have the De Clerambault syndrome. De Clerambault syndrome. And we have the Covades syndrome. Othello syndrome, we all know, is a delusion of lollipop MCQ. It is straightforward 1 second MCQ. Othello syndrome is delusion of infidelity. The partner believing that the partner is unfaithful. That's a that's a again stuck. Capgras is delusion of doubles or duplicate. Somebody will say he is not my brother. He's a duplicate of my brother. It's a physical double. It's a physical double. Very good. But we must know there is something in psychiatry called as the Frigoli syndrome. Frigoli is a delusion of mental double. It's a delusion of mental double. It means that somebody will say that that the beggar, the beggar who comes to the colony every morning actually is not a beggar. He is my office boss who dress up like a beggar to keep a watch on me. Sunday, the cobbler who comes and sits outside the colony actually is not a cobbler. He is my office boss only who make a like a cobbler to keep a watch on me. So physically he is coming in disguise, but mentally he is a same man. Yeah. Difficult to remember. I would say ki let's remember like Cabgrass is a physical double and Frigoli is a mental double. Cotard is a nihilistic delusion. I am ending. My intestines are rotten up. Kidneys are no there. That's a nihilistic delusion. Okay. Found in severe depression. It's a delusion of nihilism. Declarambald is a delusion of love, or what has been called as the erotomania. Delusion of love, what has been called as the erotomania. Riksha puller believing that Priyanka, either Gandhi or Chopra, in love with him. It's a Declarambald syndrome. Okay. But the name is commonly used for a female client, and the MCQ we have is that lady working as a housemaid believe that Salman Khan is in love with her, giving messages to her, missed call to her. It's a case of a D. Clarenbold syndrome. Covade is an interesting one. It's a delusion of being pregnant by male partner when female partner is pregnant. When the wife become pregnant, husband start believing that he also become pregnant. That's an interesting one. It's a Covades syndrome. So these are some special named delusion. Also to appreciate, okay, that there is something in psychiatry called as the superstition. Superstition is also a fixed belief, firm belief, false belief, but shared by, not shared by, shared by others and matching with the, so that's a superstition. So my all friends believe, all my community believe that the cat crossing the way, the बिल्ली रास्ता काट जाएगी तो काम बनेगा नहीं. So that's a delusion. Okay, that's a superstition because it's also a fixed belief, firm belief, false belief, but shared by number of people in the community. ठीक है डॉक्टर साहब? Okay. Now, lady having two depressive episode in the past now has a low mood and restlessness. Again, same. And also start saying that my daughter wants to kill me. Diagnosis is बताएं डॉक्टर साहब। वेलकम डॉक्टर सुमित। बताइए डायग्नोसिस। It's basically a two depressive episode are in the past, and now she believed that, well done, it's a B. It's a severe depression with psychotic symptom. Severe depression with psychotic symptom. Well done, Dr. Sadav, Dr. Rockstar, Dr. Sumit, and insane doctor. Well done. And Dr. Achan Khan. So we all know that depression is of, so what in English we called as depression, in psychiatry it is being called as the major depressive disorder. And nothing major about it, it's just a name to say it. And in this there is a persistent, pervasive for 14 days. The mood has to be low for 14 days. And symptom cluster you all know are sadness of mood, lack of interest, lethargy. Three are the major symptom. Okay. Then we have the decreased appetite, weight loss, decreased sleep. Classically it's a early morning awakening, नींद जल्दी खुल जाती है. Then decreased libido, poor attention and concentration, forgetfulness, crying spells, excessive guilt, pessimistic view of future, ideas of hopelessness, helplessness, worthlessness. एंड इससे अच्छा तो भगवान उठा ले, मर जाऊं मैं, डेथ विशेस, सुसाइडल आइडियाज, सुनता नहीं वो तो अटेम्प्ट कर लिया मैंने, सुसाइडल अटेम्प्ट. So these are all the symptom cluster of a depression. I am telling you so because psychiatry is a very simple mathematics and we will learn many free MCQ based on this. They ask you simple question that to call anybody as a depression, the low mood has to be there for how many days? 14 days. To call anybody mania, the mood has to be high for 7 days, and for hypomania the mood has to be, the high for the 4 days. So this is a simple lollipop. For depression, 14 days. For calling anybody as a mania, the mood has to be persistently, pervasively sad for 14 days. I am just overshooting the answer so that you know the mathematics. We have a mild, moderate, Well done, Dr. Rockstar. And severe depressive episode. Mild we know is so I hope you understand that 2 plus 3, 2 plus 4, and anything more than 2 plus 4 will be called as the severe depression. Severe depression is of two types: severe depression without psychotic symptom or severe depression with psychotic symptom. साइकोटिक सिम्टम क्या क्या हो सकते हैं डॉक्टर साहब? कानों में आवाजें आ रही हैं, चलो चलो आ जाओ, बहुत हो गया नीचे, आ जाओ ऊपर आ जाओ, आत्महत्या कर लो, सुसाइड कर लो. Somebody hearing voices to call him above, it's a auditory hallucination. Or I may have a Cotard syndrome. I am ending, my intestines are rotten up, kidneys are damaged, or I have a delusion of guilt. I am having a delusion of guilt. Now, why it's so important to learn like this? Because for somebody with the psychotic symptom and somebody attempting suicide, the treatment is electric shock. So we learn many MCQs from this one line. That we don't give electric shock to everybody. Anybody attempting suicide and having a psychotic symptom with severe depression, that is a candidate for the electroconvulsive therapy. Okay. Okay. So next we come on to the simple question. The most common cause of suicide is depression. The most common phase of depression for suicide is the depression in recovery. It's a depression in recovery. So that is the worst phase for committing the suicide. See, when I'm really depressed, I really want to kill myself, but I can't. I know railway track is so far, and I can't know how to, how to fan is so high. How can I kill myself? But once my depression start improving, I know I can put a table beneath and hang myself. I can easily hire a Ola Uber cab and can go railway track and kill myself. So that's the worst phase for committing the suicide. The most common age group for suicide is the in the Western world it's a elderly men. In India, it's a between 14 year to 29 year of age. Then we have the chemical responsible for suicide. सो ही करेंगे डॉक्टर साहब, चिंता नहीं करिए थोड़ा जरा. It's a serotonin. Okay. So that's all about the bit of a depression we must be knowing. Now, patient has a COVID last year. Now it's 4 year and he's recovered. Now he's having fear that he might die of a COVID. He has tachycardia, tachypnea, and for past 3 months. The most likely diagnosis is पैनिक अटैक नहीं कह सकते, टैकिकार्डिया है, टेकेपनिया है, but the thought that he is dying of cancer, the COVID, will put into the category of post-traumatic stress disorder. So there is a reliving experiences. There is a reliving experiences. Emotional symptom and avoidance. Here he can't avoid, but we have to say it's a post-traumatic stress disorder. And in this reliving experiences, we have a illusion, we may have our dreams, we have flashback, we have reliving experiences. Emotional symptom can be shocking, numbing, or he may be hyper alert. So this is all been called as the post-traumatic stress disorder. Panic attack, we all know it's a sudden, severe, spontaneous attack of anxiety. Building up in 10 minutes, lasting for half an hour, with a feeling of impending doom. Either I die or I'll go crazy. Not like exam. Yeah, panic attack you can have, but by definition of panic attack, it has to be khali pili bina baat ke. It has to be spontaneous attack. Exam will be the acute anxiety attack. For panic attack, it has to be spontaneous. That is also a question that anxiety of panic attack differ from the anxiety of the acute anxiety attack in that it is a spontaneous. For no reason, there is a very high anxiety. So it's a PTSD. And we know the treatment of choice of PTSD is behavior therapy, and drug of choice is SSRI. In behavior therapy, we have the new therapy, it's a EMDR, eye movement desensitization and reprocessing. So that's also a question that treatment of choice of PTSD is EMDR, EMDR, and EMDR. Eye movement desensitization and the reprocessing. But drug of choice is the SSRI. We have therapies like CBT as well, but this is a popular MCQ they are asking nowadays, that treatment of choice of PTSD is EMDR, EMDR, and EMDR. ठीक है डॉक्टर साहब? Now this man, what actually is having? Taking alcohol for last 26 years. Recently increased alcohol to 1 bottle per day for last 2 years. Now he has a tremors, hearing voices, restlessness, talking irrelevantly. He is experiencing. बताएं डॉक्टर साहब. Intoxication नहीं है डॉक्टर साहब. It insane doctor is right. It's a delirium tremens. It's a delirium tremens. We know alcohol is a CNS sedative. CNS sedative is not a good work. It's a CNS suppressant. Alcohol is a CNS suppressant. Now when I take alcohol, too much alcohol, every day my CNS is calmly suppressed. Now once I leave it, brain will be hyper excited. So we'll have a delirium. We have delirium tremens. Plus autonomic hyperactivity. So delirium, tremors, and increased pulse, increased BP, increased respiratory rate, increased sweating, increased brain activity. Okay. Increased brain activity. So we have questioned that delirium tremens are being found in alcohol withdrawal. Delirium tremens are being called as delirium tremens because there is a delirium plus tremors plus autonomic hyperactivity. And treatment of choice of delirium tremens क्या होता है डॉक्टर साहब? Will be something like alcohol, and that is benzodiazepine. We have 3 questions to this as well. That we first choose the chlordiazepoxide, the longest half-life benzodiazepine. If it is a seizure plus delirium tremens plus hyperactivity, we give injection diazepam. If there is a liver function test is not available, we have to give the lorazepam, oxazepam, or tinazepam, because these are the benzodiazepine not metabolized by liver. These are the benzodiazepine. So one question has come in 3 forms, that somebody who was taking alcohol comes to us emergency. It is delirium tremens and drug of choice is chlordiazepoxide. Then there is a seizure also. There is a patient is very hyperactive. Then the drug of choice will be the injection diazepam. And third time, the liver function test is not available. So what should we give? When the liver tests are not clear, not available, we have to give the medicine which is not being metabolized by liver, that is lorazepam, oxazepam, and tinazepam. So that's a delirium tremens in completion. Multiple MCQ. Delirium tremens is being called as delirium tremens because there is a delirium plus tremors plus autonomic hyperactivity. Now, next question. Now, again, it will be simple. When you withdraw, the first side effect will come is. That's interesting one. Person taking alcohol for last 26 years. The first is the tremors. Most common withdrawal symptom is tremors. ठीक है डॉक्टर साहब. Earliest to come tremors. So alcoholic hallucinosis comes after 6 to 7 after hours, 48 to 72 hours delirium tremens, and seizures comes after 12 to 24 hours. So earliest side effect is the tremors. And we also now learn the timeline for the other withdrawal. We have insomnia, we have anxiety, we also have the alcoholic hallucinosis which comes around 6 to 7 hours after it, and seizures will come. Okay. Yeah. Now, man, 3 year history of irritability, low mood, lack of interest in surrounding, general dissatisfaction with everything, no significant disruption in the sleep and appetite. He is likely to be suffering from. It's a 3 year history. It's a dysthymia. What is dysthymia? It's a subsyndromal depressive symptom for 2 years in adults and 1 year in. Okay. So it's a dysthymia. Well done, Dr. Insane. Rishabh it is major depression may there has to be disruption. It's a not much disturbance. Today's world it is being called as the today we call it as a in as per DSM-5 we know we call it as a persistent depressive disorder. It is something like those people who are like we all have friend like them, friend like who are never been happy, they always complain, they always brood, they are never happy with anything. That is called as dysthymia. We all have been blessed by a friend like them, we soon remember them. In psychiatry they have been called dysthymia. Now same friend of mine, there is something in psychiatry called as double depression. Same friend of mine who's never been happy now really become depressed. It will be called as double depression. It's a depression on dysthymia, or it's a major depressive disorder on persistent depressive disorder. ठीक है डॉक्टर साहब. Okay, so that is how it has to be. So it's a loving MCQ of the FMG. What is double depression? Now, somebody having dysthymia now really become depressed. It's a double depression, or it's a major depressive disorder on the persistent depressive disorder. Now, 3-month-old child diagnosed with mild depression, what therapy should be prescribed? बताएं डॉक्टर साहब. So we can always go for the CBT alone. We know mild to moderate for mild depression we may try the antidepressant alone. नहीं ऐसा तो नहीं है डॉक्टर साहब. Mild के लिए I think CBT is the alone answer because there is a 3-month-old child. So we would not like to give the exposure to the child. But otherwise we have a common dictum to appreciate that. पुनीत जी ये सी क्यों कहेंगे डिप्रेशन अलोन क्योंकि प्रेग्नेंट फीमेल है. No, I don't think so. So we say that mild to moderate depression can be managed by behavior therapy, or we say it's a cognitive behavior therapy. And we say all drugs are equally effective and choice depends upon side effect profile of a drug. ठीक है डॉक्टर साहब. For severe depression, the drug of choice is TCA, tricyclic antidepressant. For resistant depression, we have the combination of yeah, after 1 year we can give the medicine. We can give medicine anytime. See, if it's a moderate depression, we should not hesitate to give the medication. Okay, but that's another MCQ we remember. 3 MCQ we learn that for severe depression the drug of choice is the tricyclic antidepressant. For mild to moderate depression, all drugs are equally effective and choice depends upon the side effect profile of a drug. For resistant depression, it's a combination of fluoxetine plus olanzapine. ठीक है डॉक्टर साहब. So okay. इसको छोड़ देते हैं, ये हमारा नहीं इम्पोर्टेंट है. ओल्ड एज में All are the reason of the cognitive impairment. We better say it's a learning exercise because all are correct. All are correct. Thiamine is not there, except होना चाहिए. If you write it except, then answer will be the thiamine. Thiamine cause in memory lapse, alcoholism. Okay. Vitamin B12 deficiency, folic acid deficiency, niacin deficiency, they are the reversible causes of dementia. So thiamine causes the memory lapse in a patient of alcoholism, but and it caused the, we know it caused the Korsakoff psychosis. It caused the Korsakoff's psychosis. Though it's a misnomer, झूठा नाम है ये, as there is no psychosis. It's a recent memory loss plus confabulation. What is confabulation? It's a filling up of a memory gap. Filling up of a memory gap. Okay. You ask somebody what you have on a breakfast today. He don't remember what he had on a breakfast today. He tell you, I have taken the idli vada. Idli vada he has taken 3 months ago when he was in Chennai, but he just say that. It's a Korsakoff's psychosis. So that is caused by the thiamine deficiency in patients of alcoholism. Okay. Acute stage called as the Wernicke's encephalopathy, characterized by acute confusion, ataxia, and ophthalmoplegia. Okay. So we learn about thiamine and we learn the 3 vitamin causing the reversible dementia. ठीक है डॉक्टर साहब? Okay. Yeah. Oh my God. An alcoholic develop the delirium tremens. Treatment given is the injection lorazepam. But if this is a choice, we have to select the thiamine because we learned that if we do not supplement thiamine in alcoholic, there is a high chance they go for a Wernicke's encephalopathy and Korsakoff's psychosis. So well done, Dr. Insane. आप ही रह गए, लोग तो बहुत हैं और लोग प्लीज जवाब में पार्टिसिपेट करिए. Okay. So answer is thiamine. Otherwise, drug of choice of delirium tremens, we said it's a lorazepam, but the treatment we give, we make sure that the thiamine should not be deficient. Now, that's a latest MCQ. Sudden transient muscle weakness while being fully conscious, usually triggered by laughing or crying, is caused by deficiency of which neuropeptide? or orexin. And the illness has been called as narcolepsy. It's a narcolepsy, that's why we are talking. Narcolepsy is an illness which actually make us to believe that we have to practice the previous year's topics rather than previous year's questions. ठीक है डॉक्टर साहब? So narcolepsy has been started asking us MCQs like that. Narcolepsy is a pentad of sleep attack, sleep paralysis. We have cataplexy. Cataplexy is a sudden break in the tone of muscles. Sleep attack, sleep paralysis, cataplexy. We have the hypnagogic, hypnopompic hallucination. And we have a abnormal intrusion of REM in EE. And we have a simple MCQ that the most common, next time they ask you, most common type of the is the visual hallucination. Most common type of a hypnagogic and hypnopompic hallucination is a visual hallucination. Narcolepsy sleep attack lasts for 10 to 15 minutes maximum. Center of the narcolepsy lies in hypothalamus. Drug of choice was methylphenidate. Now the answer is modafinil. ठीक है डॉक्टर साहब? So it has come like this. First they ask you drug of choice, then latest drug of choice, sleep attack lasts for how many time, and it's a disorder of REM sleep. It's a disorder of the REM sleep. Sleep attack, sleep paralysis, cataplexy, hypnagogic, hypnopompic hallucination, abnormal intrusion of REM in the EEG. Center of that is the hypothalamus. ध्यान रखना है, सवाल खत्म भी करने हैं. It is of two type. Narcolepsy has been recently. Type 1 is idiopathic. Type 2 is iatrogenic or post traumatic. Association with the major histocompatibility complex type 2. Loss of the hypocretin producing neurons in hypothalamus. HLA TR HLA-DR4 it is, sorry. And this is the and has all pentad of narcolepsy, has cataplexy, low CSF levels of hypocretin or orexin. What I want to highlight here is that, see, it is first starting as a what is narcolepsy, then what is a pentad narcolepsy, then they ask you next time that hallucination commonly seen in the hypnagogic hypnopompic is visual hallucination. Then they ask you treatment of choice. Then they ask you center, and then they go further beyond that कि center में भी क्या chemical कम है, and it's a chemical which is less is the hypocretin, the alertness chemical promoter. ठीक है डॉक्टर साहब. And type 2 on the other hand is a has all features except cataplexy. Post traumatic post meningitis, it can happen, and it's a has all the features of narcolepsy except the cataplexy. ठीक है डॉक्टर साहब. Okay. Now SSRI is what? SNRI has been prescribed. Which is that drug? बताओ डॉक्टर साहब. it's a venlafaxine. We know it's a SSRI. It is SNRI. It is ND. It is NASA. It is NDRI. तो डॉक्टर साहब करिए, मुश्किल नहीं है ये तो. सी नहीं 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 फ्लॉक्सिन SSRI. पुनीत जी नहीं, इंसेन डॉक्टर साहब नहीं. एनीबडी एल्स? Yeah, it's B. Very good. It's a venlafaxine. It's a B. Okay. So we learn that it's a loving MCQ. We have tetracyclic antidepressant. We have tricyclic antidepressant. We have SSRI. We have SNRI. It's a selective serotonin reuptake inhibitor. It is serotonin noradrenaline reuptake inhibitor. Then we have the NARI, NDRI, noradrenaline dopamine reuptake inhibitor. We have NASA, noradrenaline selective serotonin augmentation. We have SSRE, selective serotonin reuptake enhancer. Okay. Tetracyclic drug is the amoxapine. Imipramine, amitriptyline, fluoxetine, fluvoxamine, sertraline, escitalopram, this is venlafaxine, duloxetine, Nari is riboxetine, bupropion, mirtazapine, trineptine. ठीक है डॉक्टर साहब. So these are the class of drug we must remember because they ask you in the exam. SNRI, SSRI, NDRI are what? Okay. Is it okay way that we are proceeding that way? Or should we do the MCQs and you know MCQ also will take minimum 1.5 hour, 100 MCQ. Even if we give 1 minute to watch MCQ, it will be 90 minutes to 1.5 hour. So okay, like this, we are understanding and finishing off topic in detail. Okay, well done. Okay. Now, typical characteristic of Alzheimer's disease. Drug which act on which receptors? Without answer. Dopamine we know high in schizophrenia. We give antipsychotic which are D2 blocker. Low in depression. Low in depression. Well done, insane doctor. It is choline. We give donepezil. We give rivastigmine. We give the galantamine. All of them are cholinesterase inhibitor. So all three drugs which used in the treatment of Alzheimer's disease are basically blocking the damage of the destruction of the choline. So yes, the chemical responsible for Alzheimer's disease is the choline. Excessive concern with the physical appearance, inappropriately seductive, shallow labile effect, being self-centered, acting dramatically are feature of feature of we say it's a histrionic personality disorder. Okay. Well done, insane doctor. Well done, Dr. Trisha. It's a histrionic, dramatic personality. We would learn the personality disorder topic in a one go. So we say that personality is a persistent, pervasive lifestyle of individual by which he or she is known. Okay. We say it usually forms in adolescence, and we say no personality is good or bad, but if causes dysfunction, it will be called as disorder. Well done, Dr. Husna Naz. It's a histrionic personality disorder. Okay. And we learn these three dictum that कोई personality अच्छी बुरी नहीं है, but if it is causing dysfunction, that is called disorder. And to understand personality, we learn the personality in a clusters. We have cluster A, cluster B, and cluster C. If you know it, it will be wonderful. Cluster A is odd and eccentric. B is the attention seeking. C is the anxious. Sorry. Okay. It's a paranoid PD. Paranoid PD, schizotype PD, schizotypal personality disorder. Odd and eccentric. Attention seeking will be the narcissistic PD, antisocial PD, and borderline. Anxious is anxious avoidant PD. Very good. Dependent PD. And anancastic PD. Also, it has been called as the obsessive compulsive personality disorder. ठीक है डॉक्टर साहब. If we remember this single page, we will be able to handle the MCQs which is asked in exam. They'll ask you simple lollipop MCQ if you learn like this. Paranoid PD is. Paranoid PD is cluster. Paranoid PD is cluster A. Antisocial PD is cluster B. Histrionic is cluster B. Dependent PD, anxious avoidant PD is cluster C. Well done. So if we remember this one page, the whole of the the personality MCQs usually asked in FMG exam will be managed. ठीक है डॉक्टर साहब. Okay. Now hypochondriasis in DSM-5 is called as hypochondriasis in DSM-5 is being called as the illness anxiety disorder. So we say that We have somatoform. Well done, Dr. Tariq. Somatoform pain disorder. We have somatization disorder. So we have here the hypochondriasis. This has been called as the somatic symptom disorder. Here the name is the somatic symptoms and related disorders. Here the name was somatoform disorder. नहीं that's all. Hypochondriasis is being called as the illness anxiety disorder. So the name of the somatization disorder and somatoform pain disorder has been called as the somatic symptom disorder. The hypochondriasis is basically, the unduly they believe minimal symptom as a major some physical illness, that is called hypochondriasis. So it has now been clearly indicating a illness anxiety disorder. Factitious remain the factitious disorder. Yeah. So just to revise one line, okay. Somatization is multiple symptom from multiple system for 2 years, for which doctors don't have any signs. Basically, it's a all group of disorder in which patient comes to doctor with some bodily symptom for which doctors do not find any sign. So that is the criteria you must remember. ठीक है जी. So these are the group of disorders. Whether we say somatic symptom and related disorder, whether we say somatoform disorder, patient will come to some bodily symptom for which they do not have any signs. In hypochondriasis, no or minimal pathology is taken as a well done, Dr. Naz. Well done, Dr. Naz has made us very easy for us. Very good. Minimal pathology is taken as a sign of a deadly disease. So Dr. Naz ने ऐसे कहा, as Dr. Naz has been telling us, that in this basically the patient come with the symptom. Here he come to you with a diagnosis. Doctor Saab, I am having the bloating of abdomen, I am having the constipation, most likely I am having the carcinoma colon. Okay, that's all. So because In both of them, they do the doctor shopping. They have the multiple investigation, but here to know the diagnosis. Here also they do doctor shopping. They have the multiple investigation, but to confirm the diagnosis. Figure out, sir. So that's all about this concept. Well done. For tobacco dependence, we use the NDRI. We know the nicotine increase the choline and dopamine. This is a memory chemical. This is a kick chemical. Well done, Dr. Insane. It's a bupropion. NDRI. Well done, Dr. Tariq. Multiple A's he marked. And Nos has given the name. It's a NDRI. If we know that it's a NDRI, we have to give. So it is a SNRI. It is a SSRI. It is also SSRI. So anything which increase the dopamine, that will be used for the tobacco dependence treatment. Hormone which is being used to treat the insomnia. It's a simple question again. It's a melatonin. Melatonin, we all know it's a natural chemical we all have. It acts on the pineal gland and lead to the onset of the sleep cycle. ठीक है डॉक्टर साहब डॉक्टर अनिल से भी आ गए हैं तारिक साहब भी आ गए हैं इट्स अ मैराडोन इंसेन साहब भी हैं now anesthetic agent used for the severe depression recently you must have heard of Hollywood some brother serial actor he died because of ketamine okay so ketamine we give IV ketamine can release depression okay okay now that's up Dr. Rohit wants to know what is the difference between the I'm sorry I did not discuss that dysthymia and cyclothymia. If we know the word thymia come from the Latin word thymus, which means the mood. It's a dysregulation of the mood. That's how I'll tell you. It's a dysregulation of the mood. So what we have learned, it's a subsyndromal depressive symptom for 2 years. Okay. Cotard syndrome is nothing. देखो डॉक्टर साहब Cotard syndrome is nothing. When there is a severe depression and I have a delicious here, I can use anything. Ketamine may not be the drug of choice. We have to use the antidepressant plus antipsychotic treatment. Okay. Cyclothymia मतलब cycling of the mood. तो क्या होगा? As a name, cycling of mood. We all have been blessed by moody friends. We all have been blessed by moody friend. We soon remember them. In the morning you meet them, they are quite happy, charming, energetic. In the evening you meet them, they give you a strange look. टोटली सरप्राइज यू आर, अभी क्या हुआ ऐसे, सुबह तो ठीक था. That is what is being called as cyclothymia. What happen is subsyndromal depressive symptom. Subsyndromal depressive symptom fluctuates with hypomanic symptom. Usually within a day for no apparent reason. For 2 years. So the happiness mood and cycling of the mood happening, subsyndromal depressive symptoms and not mania, hypomanic symptoms fluctuating usually within a day for no apparent cause for 2 years is being called as cyclo. Okay, that's all. ठीक है जी, रोहित जी. Dysthymia is nothing but the another name of, we know, dysthymia has been called as now the persistent depressive disorder. And cyclothymia is na type of a BPAD 3. Okay. Okay. ठीक है डॉक्टर साहब. Now new diagnostic category ये आपके लिए नहीं है. It's a DMDD. So irritable child, chronic irritability with BPAD to prevent the overdiagnosis of, it's a disruptive mood dysregulation disorder. It's basically a MD exam question. Even if you don't do, we don't mind it. Okay. ठीक है डॉक्टर साहब. Okay. It's basically, the point is that treatment of choice will be now the SSRI compared to the persistent depressive disorder is another name for the dysthymia. So for the DMDD, it will be the treatment of choice will be the SSRI. For BPAD or bipolar mood disorder, the treatment of choice is mood stabilizer. But for the DMDD, we say it's a type of a dysregulation disorder, we give the drug is SSRI. Now the depressive symptom, again it's a MD MCQ, MDM's exam, NEET, INI-CET exam MCQ, that depressive symptoms most strongly assured with the suicidal gesture is it's a hopelessness. Yes, DMDD, the drug of choice will be the SSRI because they say it's a type of a depression. It's a disruptive mood dysregulation disorder. नहीं डॉक्टर साहब, गिल्ट सिन से बढ़िया ये तो एमसीक्यू याद करना पड़ेगा. इट्स अ होपलेसनेस. इफ यू लूज द होप देन इट इज द एंड ऑफ द वर्ल्ड. सो सोशल जेस्चर इज बाय द होपलेसनेस. ठीक है डॉक्टर साहब. ओके. Reversible dementia is caused by the deficiency of, we have just learned, vitamin B12 deficiency, hypothyroidism, लास्ट एपिसोड मतलब It's a niacin. Okay. And we have learned that the most common cause, या वो है ठीक है डॉक्टर साहब. ऐसे तो पोस्ट एनसेफलाइटिस, normal pressure hydrocephalus, they are all the reversible cause of dementia. Now we just learn it. We know dementia can be the reversible dementia, it can be irreversible dementia. Hypothyroidism, folic acid deficiency, niacin deficiency, NPH you say, normal pressure hydrocephalus, post encephalitic dementia, it's Alzheimer's disease, vascular dementia, frontotemporal dementia, well done, SDHBS. So this is all the, and the most common cause in India, yeah, most common cause in India for the reversible dementia. Okay, but Parkinson's will be the irreversible. Okay, so that's all about the dementias. 5 ways of negative symptoms are proposed by Bulailer. We know has proposed the, it has given the term dementia precox. 4 A's of schizophrenia. He coined the term schizophrenia. Autism, नहीं डॉक्टर. Schneider has given the, no डॉक्टर साहब, ये नैन्सी एंडरसन है इसका जवाब. Schneider has given the first rank symptoms of schizophrenia. ये say 4 A's are autism, ambivalence, affective blunting, and associational loosening. Yeah, Kraepelin dementia precox, Schneider's first rank symptom. Buller coined the term schizophrenia given the 4 A's of schizophrenia, namely autism, ambivalence. But the question here is the 5 A's of negative symptom. Tricky MCQ, deliberately designed. So there is a lady given the called the Nancy Anderson. Nancy Anderson given the positive, negative, and cognitive symptoms of schizophrenia. Positive symptoms are which is something extra in me. Nobody else is hearing voices. I am hearing voices. That's a hallucination is a positive symptom. Nobody believing there is a camera here. People wants to kill me. I believe so. It's a delusion which is a positive. Too much of violence is a positive symptom. Negative means which all of us do but they can't. We all have some motivation. They are A motivation and anhedonia. We all socialize. They can't socialize. We have A sociality. We all speak language. They can't speak language. It's an absence of language. It's the A logia. We all have the attention to focus. They have attentional deficits. We all have the emotions to display. They have the affective blunting. And lately, the cognitive symptoms. It's a lack of the executive functioning or memory. I can't execute any function or memory. ठीक है डॉक्टर साहब? So that's the 5 A's of negative symptom given by Nancy Anderson. Difficult question because very good. So that's a 5 A's. Well done, Dr. Nas. That's great. Now delirium. Delirium, Alzheimer's disease. It's a acetylcholine which has been less. Okay. Well done, Dr. Rohit, Dr. Insane. So we'll go further. Oh, that's again a difficult question. Tricky MCQ. So we say that all symptoms have been called as the depressive equivalent. That people are in pain, that is again an indicator of some depression. I abuse drug or drug dependent, that induce depression. Convergent disorder, dissociation disorder, it's a depressive equivalent. Pyromania is a impulse control disorder. In this, there is a sudden urge to do an action. relief after that, and later on, pyromania is a sudden urge to set fire. Fire लगा दी डॉक्टर इंसेन ने. Well done. Well done, Dr. Nas. So just we learn the various impulse control disorder are the kleptomania, pyromania, trichotillomania, pathological gambling, and intermittent explosive disorder. Yes, very good, Dr. Nas. It's to pick up things. We are psychiatrists. We use soft word. It is actually stealing only, but we say it's an impulses to pick up things, to set fire, to pull out hairs, to anger outburst. They keep on gamble till they lose everything. And we know for all of them, treatment of choice is behavior therapy, and drug of choice is SSRI. Also, we also must know that the trichotillomania has been shifted to the OCD and related disorders in DSM-5 to the addictive disorder. ठीक है डॉक्टर साहब. So trichotillomania has been put to the OCD and the related disorders, and pathological gambling can be shifted to the addictive disorders. So they are all the disorders where there is a sudden urge to perform an action, relief after that, and later on, yeah. चलो डॉक्टर साहब ने छेड़ा है तो we'll finish it off. OCD and related disorders. OCD is a big man now. As per DSM-5, it has OCD, it has the hoarding disorder. In fact, it has the body dysmorphic disorder. It has the trichotillomania. Skin excoriation syndrome, and in ICD we have also the olfactory reference syndrome, and ICD plays the hypochondriasis here. Well done. So that is what is the so hypochondriasis in ICD has been placed under the category of the OCD and the related disorders. But in the DSM, we only have 5 topics to be put under the category of OCD and related disorders. Well done, Dr. Sam. Now, encopresis is diagnosed. What is encopresis? Passing of stools at inappropriate places by child age more than 3 years. ठीक है? Because nocturnal enuresis is so yeah. ठीक है डॉक्टर साहब. So that is the encopresis. Simple sawal, simple MCQ. For diagnosing encopresis, the age has to be more than 3 years, and for the nocturnal analysis, it has to be after the, yeah. Bed alarm technique. Yes, well done, doctor. Is the best. Now this will be a 1 minute MCQ for you. Cluster C personality. Yeah. Cluster C personality includes all except. Narcissistic, we know it's a cluster B. Encopresis treatment is again the psychotherapy only. They are all reflecting the child's anxiety. So you can take care of that, it will be taken care. Now factors predicting the poor outcome in schizophrenia, or basically the indicator of poor prognostic in schizophrenia is all except. So we say that Professor T.J. Crow in 1980. Type 1 and type 2 schizophrenia. This table is doubly important because if you remember this table, there will be a double benefit, because you can easily handle the MCQs of type 1, type 2, and same table applies to the good and the poor prognosis. So type 1 is a acute onset schizophrenia. Usually positive symptoms are predominant. After a precipitating, I lost my exam, I had my breakup, I had lost my job. So there is afterward there is a some symptoms, and predominantly they are positive symptoms. I hope now you know what is meant the positive symptom. And घर खानदान में किसी को नहीं, no family history, and some of my emotions are being preserved. No CT scan, MRI finding, and it's a good prognosis. ठीक है डॉक्टर साहब. Type 2 on the other hand is a insidious onset, gradual onset. Negative symptoms are predominant. No precipitating cause. Family history is positive. And when I say that negative symptoms are predominant, you know, emotions are gone. There are some accidental or incidental CT scan MRI finding, and it's a poor prognosis. It's a poor prognosis. ठीक है डॉक्टर साहब. And we have the now adding something, somebody female, somebody married, and family history of bipolar disorder. This will be a complete table for the good prognosis. Along with that, somebody has a schizoid personality and presence of the soft neurological signs indicate the poor prognosis. Yeah, family history in a patient of schizophrenia, if there is a family history of mood disorder, that will be a good prognosis for the patient. Well done, Dr. Husnanaz. You classified and clubbed up the symptom very well. फैमिली हिस्ट्री ऑफ डिप्रेशन इज अ गुड प्रोग्नोसिस. सब लोग चले गए हैं डॉक्टर साहब, 5 लोग बचे हैं, बोर हो गए, फास्ट सवाल करते हैं. सब चले जाएंगे तो साइकेट्री खत्म ही नहीं कर रहे, छोड़े ही जा रहे हैं. 2 घंटा हो गया, 10 सवाल नहीं हुए. या after death of wife, husband is crying, distress, not able to sleep, not going for work, not taking food, lost about 10 kgs of weight in last 1 month. फैमिली हिस्ट्री ऑफ डायग्नोज डिप्रेशन है, चाहे मेनिया है, चाहे बाइपोलर है. एनी फैमिली हिस्ट्री ऑफ मूड डिसऑर्डर will be a good prognosis for schizophrenia. Saying to the god, please take me away, I should be dead in place of her, or we both should die together. It's a case of a uncomplicated bereavement or grief reaction. We know that prolonged grief is grief more than 6 months, more than 12 months. नहीं डॉक्टर साहब, it's a uncomplicated bereavement. We must appreciate that symptoms of depression till death wish in the background of death of loved one is normal grief reaction called as uncomplicated bereavement. Uncomplicated bereavement. ठीक है डॉक्टर साहब. Okay. For depression, क्या होगा? एक्टिव सुसाइडल अटेम्प्ट. आ रहा हूं तुम्हारे पास ही रहूंगा. That will be called as depression. Somebody excessively blaming himself for the death of a loved one, excessive guilt, anniversary reaction, and grief lasting more than 1 year. And last was the mummification, freezing the belonging of a loved one. Family believe it's a love. Psychiatry say, but time is not important here, doctor साहब. Time का importance नहीं है. See, here it is also, I think, 1 month, in last 1 month. But time is not important. Importance is that symptom has occurred in the occurrence background of a death of wife. So okay, it's an uncomplicated bereavement. Whether you say uncomplicated grief or uncomplicated bereavement, they are one and the same thing. So that's the concept. How to break a bad news? How to break a bad news? We know we have a spikes pattern. Setting up of interview, perception of client, introduction, knowledge sharing, what is expectation, and what is the summarize. So it's a spikes pattern. Now following are the catatonic signs. It's a posturing. It's a break in tone of muscles. It is the found in narcolepsy. And we know treatment of choice of Caronia is electroconvulsive therapy. Okay. No, mutism नहीं है. Mutism, well, Dr. Naz, yeah, Dr. Tintin, Tintin is, yes, Karnataka. Okay. Done. So that's a body is flexible like a wax. He is mute. He maintain the rigidity. They maintain the abnormal postures. Echolalia, echopraxia, and automatic obedience. That is the catatonic signs. Yeah, we must try the benzodiazepine first. Obviously, you everything doesn't have a electric shocks, circuits. So we may try the. We can go for a lorazepam challenge test. we first give the injection lorazepam. Most of time the Caledonia break up, and if not, we have to go find give the electroconvulsive therapy. ठीक है डॉक्टर साहब? Okay. Now, defect in empathy or defect in capacity to appreciate other people's feeling, especially to comprehend how people feel about the consequence of the person's action. It's a dissocial personality, or what is being called as antisocial. So these people have no guilt, no empathy, never learn from past mistake. They have a extreme sense of rights, does not follow social norms. This social or antisocial personality disorder. ठीक है डॉक्टर साहब? Schizoid, we know it's a highest level of introversion. 2 घंटे हो चुके हैं. So we'll be fast. It is borderline PD. That's I'll just join in 2 minutes. Water break. Just 2 minutes. The break is over. So that's all. Sorry, Dr. Sir. So I don't know how many questions I've done. I have marked the number. Number is missing. What is the basic disturbance in psychosis? Delusion, hallucination, or loss of touch of reality. So psychosis is a in clear sensory. पूरे होशो हवाश में होता है जो होता है. Loss of reality testing, that they cannot do. They lack the reality testing. ठीक है नहीं. Delusion, hallucination, and disorganized behavior in the, but it's a very basic. What among the all? Among the delusion, among the hallucination, among the everything, the best is the loss of reality testing in clear sensory. पूरे होशो हवाश में होता है जो होता है. I am not into my delirium. ठीक है डॉक्टर साहब. Now male found to have a, बताओ डॉक्टर साहब. 16-year-old man, mental age 9 years, it's a We know mild is less than 70 is mild. We say that IQ less than 70 is being called as the mental retardation. We know as per DSM-5 it is being called as the intellectual disability. So 50 to 69 is a mild MR. Moderate, ठीक है डॉक्टर साहब less than 20 will be the, yeah, sorry. So that is the mild and, पर इसका जवाब क्या है डॉक्टर साहब? ये इंपॉर्टेंट है, ये इंपॉर्टेंट है. IQ is equal to mental age upon chronological age into 100 till 15 years of age. After 15 years of age, अच्छा, 16 years of age. Sorry. IQ is equal to MA upon 15 into 100. So whatever my age after the 15 years of age, I'll divide by 15. Yeah. So in this formula, the IQ will equal to 9 by 16 into 100. It is somewhere in the category of moderate. Okay. Question हुआ था 16-year-old man, IQ of MA of 9 years. So it is 36. Now, Magnan's symptoms are produced by उसमें गलती करा डॉक्टर साहब हमने डिवीजन बाय 15 ठीक कितना बदल गया so it's a 60. Well done Dr. Tintin and Dr. Nazma, sorry, insane Naz, sorry. Dr. Hussain, Husna Naz, sorry. It's a cocaine bugs, tactile hallucination, or called formication. So we have a question that tactile hallucination plus psychosis. or formication and psychosis found in cocaine. In cannabis, we have a flashback and psychosis. तो फॉर्मिकेशन कह लीजिए, कोकेन बग्स कह लीजिए और टेक्टाइल हेलुसिनेशन कह दीजिए, इट इज वन एंड द सेम थिंग. ठीक है डॉक्टर साहब. ऑन लिथियम टेस्ट आर मैंडेटरी. बताओ डॉक्टर साहब, फास्ट फास्ट करना पड़ेगा, 12 बजने वाले हैं, ज़्यादा हो जाएगा. कैनाबिस रैंडम यस. सो मैंडेटरी टेस्ट हैं KFT, thyroid and pregnancy test, except the bilirubin, because lithium side effect is hypothyroidism, diabetes insipidus. It can lead to Epstein's anomaly. So we must have done this salt test, not the bilirubin level. Well done, Dr. Insane. It's a D. Khan साहब नहीं. Mandatory before accept सवाल है. Yeah. Well done. So thank you for joining again after a water break. All 13 in number. Now this lady hospitalized for dehydration caused by laxative use. She admits that she has been using laxative because she has been binge eating frequently and worried about gaining weight. Although the woman is very thin, she believes that she is overweight. So that is the well done डॉक्टर साहब, बहुत अच्छा पढ़े हैं आप. खान साहब, अचन खान जी, it's basically a anorexia nervosa, because in this the cognition is despite being lean and thin, they believe that they are overweight. Here the preoccupation with the food. So it's anorexia nervosa. They are lean and they are lean and thin. They maintain the normal weight they have, as BMI is less. Very good. That's a binge eating can be there, but the question says ये heart का आ रहा है. Binge eating can be there. See डॉक्टर साहब देखिए, binge eating can be there, but it's a cognition. See, anorexia nervosa is of two type. Anorexia nervosa is of two type. Binge eating type, first of all, is a restricting type. I don't take food. Other is a binge eating, vomiting, purging type. But the cognition is important. What I am thinking is important. Cognition is the key factor. Now, BMI is the key factor. BMI less than 17 is anorexia nervosa. Okay. Eating disorder itself will be a long class, but that is the point we must remember. And we must know that now anorexia nervosa has been categorized as a mild, moderate, severe, extreme on the basis of BMI. ये भी सवाल है. BMI more than 17, between 16 to 16.9 BMI, 15 to 15.9, less than 15 kilogram per meter square. आप इन रिजल्ट साइन लिखा है, आप ही पूछ रहे हैं. बुलिमैन और वो it's a number of episodes of compensatory vomiting or purging per week. Number of inappropriate mild is 1 to 3 episodes of per week, 4 to 7 episodes of inappropriate compensatory mechanism per week, 8 to 11 per week, more than 11 per week. So that is the, yeah, well done Dr. Saab. इनसेन डॉक्टर साहब ने बड़ा अच्छा जवाब दे दिया, आपस में ही समझ लिया, ज्ञान बढ़ा दिया. वेल डन. On the knuckles there is a blackening. On the knuckles of the fingers, I keep on doing this vomiting. So there is a blackening of my knuckles. I put my fingers inside my mouth. The acid actually, made the pigmentation of the knuckles of the hand. That is called the Russell sign. Well done, Dr. Insane and Dr. Naz. Very good. Digit span test. Oh my God. डॉक्टर साहब ये तो बड़ा मुश्किल है, हमको भी नहीं मालूम है, but we'll do it sometime. Digit span test. Digit forward, digit backward they do. Digit span, I don't know. Digit forward and backward is that we just ask the patient to repeat the digits, what we are speaking, numbers. So 5-digit forward, backward, we must remember. That's a test for the, the recent memory. Okay. And the attention and concentration. Okay. Yeah. For your fast. Lady taking food large quantity. She takes food and does vomiting and purging after that. Each time she take food. Diagnosis is 5-digit forward, 5-digit backward. Yes. So answer is, in binge eating disorder, large quantity of food is taken. It's a bulimia nervosa. That's a do not go by my. Yes, very good. Food is taken each time with no compensatory mechanism. Bulimia nervosa, food plus compensatory mechanism like vomiting, purging, and so on. It's a bulimia nervosa. Binge eating is basically when there is a large amount of food is taken, each time the food is taken, but without any compensatory mechanism. Now, id ego superego theory given by Freud. So he says superego is a moral values. It works on the pleasure principle. Yeah, binge eating, no compensation. Bulimia, compensation. Well done, Senorita. It's a superego. Id ego superego. Freud given the theory that why anybody is doing work because of the pleasure principle, and superego comes in between and tell the reality, and the ego is the reality or the balance. Well done. Delusion of nihilism and early morning awakening are features of the melancholic depression. Old age depression, melancholic depression have the characteristic feature of we have learned early morning awakening is a classical feature. It's a melancholic depression. DD is very good. Psychotherapist find herself getting angry at the patient after patient reports beating her little brother. This phenomena is difficult है आपके लिए. Transference is the emotion of a patient for therapist. No, no, no. नहीं नहीं नहीं. It is interpretation need WhatsApp. Doctor insane doctor is doing right. It's a counter transference. Emotion of a patient for therapist has been called as transference. Therapist भी human being है. उसके मन में कुछ भावना मरीज के लिए आएगी. That's a emotion of a therapist for patient is been called as the कुछ भी नहीं है ऐसी टाइम पास नथिंग नथिंग देखिए द person will acknowledging identifying psychotherapist find herself getting angry at a patient after patient reports beating her little brother. ओके देखिए सवाल आ गया. Formication and delusion of persecution are found in the cocaine. Flashback So it's a cocaine abuse. ठीक है डॉक्टर साहब? Well done. Not taking to anybody, not taking food, incontinent. All parameters are stable. Does not respond to even painful stimulus. Eyes are open and lusterless. It is a stupor. Stupor is a triad of mutism, akinesia, and no response to. Stupor is a triad of ना मैं बोल रहा हूँ, ना मैं movement कर रहा हूँ. I am not showing any response to the either the external or the internal stimuli. Okay. ठीक है डॉक्टर साहब. Hope you're enjoying it. I don't know how much we will be able to do till 12. It will be too much to enjoy. Memory loss is usually not a initial symptom in which of the following disorder: Alzheimer's disease, vascular dementia, and frontotemporal dementia. See, they usually present with some other symptom like behavioral disorder, movement disorder, or other neurological symptom. Frontotemporal dementia, that's a it's a Pick's disease. Types of a cortical dementia only when predominantly the frontal lobe is involved. Okay, I give you a valid reason for that. Okay, so we define the reason as a cortical dementia. We have subcortical dementia. Cortical dementia means predominantly when the cortical structure are involved. We have agnosia, we have prosopagnosia. Obviously, memory loss will be more. Ultimately हो जाएगा दोनों में. Yeah. As Dr. Husna Naz is very classical good student, she guide us and tell us that very right thing that in the vascular dementia there is more of a neurological deficit rather than the memory loss. Very good. So here it will be agnosia, prosopagnosia, acalculia, apraxia, anomia, aphasia, and memory loss. So cortical matlab we have the cortical structure involved, Alzheimer's disease, and we have this Pick's disease. That is the frontotemporal dementia when predominantly the frontal and temporal lobe is involved. In the subcortical variety, first of all, we have a movement disorder. We have basal ganglion as the subcortical structures, as seen in the Parkinsonism. The first symptom is a movement, and here he has a emotional symptom. We have the complex hallucination. They are the along with the memory loss. ठीक है डॉक्टर साहब? Very good. Risk factor for suicide except, without that, sir. Marriage, marital status, though we say it's a risk factor for, appears to be a risk factor for suicide, but actually it's a prevention of suicide. So appears to be a risk factor, but actually it's a, well done, Dr. Senorita, well done. So married protect the emotional vulnerability of the client, though on the contrary, it can also increase the emotional vulnerability. But yes, no, no. Old man is a dangerous man to commit suicide. So, except पूछा डॉक्टर साहब. Following are the risk factor. Marriage is a protecting factor. The jokes are all around, but yeah, yeah. What is there? Thank you. See, old age depression is a risk factor. Question is, all are the risk factors for suicide except the marital status. या वो दो तो है ही डॉक्टर साहब, मजाक का बात है, लेकिन एमसीक्यू इज एमसीक्यू. Vending lunatic is presented before chief magistrate by police. He needs to be admitted in the mental health hospital for further management. Magistrate will issue a reception order. Basically, that is the reception order. That's a name. You must remember that if any vending lunatic is there, we have to get for a reception order. That's a name. Ramesh, a businessman, has taken. No, no, no. B nahi hai, that's a. That is not B. No, it is B. Yes, reception order. Very good. Mr. Ramesh, a businessman, has taken a multiple bank loans from nationalized bank, unable to make payment, brought to psychiatric evaluation. He has been denying any money he has taken from any bank. Otherwise, all other memory functioning is pretty intact. It's a dissociative amnesia. It's a stressful event plus loss of memory. Fugue is a French word meaning travel. So it's a stressful event plus travel to uncommon place. Loss of memory. Okay. नो डॉक्टर साहब फ्यूग नहीं है. अच्छा बी है इसका. चलो ये इसका बताइए. इसका इज दी dissociative identity disorder is a multiple personality disorder. Person having two or more personality and is not aware that he is having two or more personality. ठीक है डॉक्टर साहब. So it's a dissociative amnesia. There is no injury to the brain, but stressful event he is not able to recall. That's a dissociative amnesia. Now, picture depict. It's a common sense question, I would say. It's a common sense question. About any addiction. A memory intact है. Other memories are intact. He is basically denying any memory of taking the money or loan from the bank. But otherwise, other mental abilities are pretty intact. Okay, that's a question. बताइए डॉक्टर साहब. More of a, sorry, it's a B. Basically, it's a B because the B has a not have very high peak. It is just keep the level at the basic. So that's a B. Again, it's a midline. Clearly, it will be a convergent disorder. Dissociative. How to solve this? Which one? नहीं 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 देखिए मेमोरी लॉस जो होती है देर इज अ स्ट्रेसफुल इवेंट and I don't have any memory to that event. Now I purchased a car. I went to the temple in the whole family with my car. And when I was out to take a prasad, there is a bomb blast. Whole family blown off in front of my eyes. And I am asking, where is my family? Oh, they all died in front of you. सब मर तो गए तुम्हारे सामने. But I don't believe so. Other than that, I am okay. But there is a stressful event. I have taken too much of loans and I can't repay them. Managers are following me, so I do not believe that I have taken a loan. I do not have a memory that I have taken the loans from bank, but otherwise I am memories are intact. So stressful event plus loss of memory to that event usually is the dissociative amnesia, but otherwise memory is not impaired. Similarly, it's a dissociative sensory disorder. The patient doesn't know that body is being crossing. So single line, all loss will be the conversion disorder. That graph one, अच्छा sorry, graph वाला अक्सर ये है that any addiction which is making me to liable to be addicted, it will give me a peak, and peak will be which gives me the kick, and then it will come down. And when it comes on in a short time, it will be again I will always demanding the. So a nicotine gum ensures that nicotine does not go very high anytime, because very high will be indicating of a some or the other kick. So it will be just to maintain some level of nicotine and then keep it for long time and then go. Sudden surge of chemicals, sudden surge of any kick actually invites the addiction. ठीक है सर. ओके ठीक है डॉक्टर साहब. Now again, DBT is done where? It's basically a simple question, difficult question for your level, but I hope we are having a good students. So DBT is being done for, it's a dialectic behavior therapy. Dialectic behavior therapy. ठीक है डॉक्टर साहब. It's done for the borderline personality disorder. Now least like to be used as a date rape drug. Here it will be the ketamine का पता नहीं डॉक्टर साहब. Yeah. So alcohol least likely to be used. Least likely to be used. So just will write the learn the here. Okay. Technically, it is called drug facilitated sexual assault. Gamma hydroxybutyrate, ketamine, flunitrazepam is a commonly used drug. Chloral hydrate, alcohol is least likely. MDMA, midazolam, temazepam, zolpidem, they are less. But basically, it's a least likely is the alcohol. ठीक है राट साहब. So these are the name of the drugs which can be used as a date rape drugs. Now, just away, what is this? सब कर रहे हैं आजकल डॉक्टर साहब, पता ही है आपको. Huffing, vaping, chasing, snorting. Huffing, it's a vaping. सभी लोग कर रहे हैं डॉक्टर साहब. Chasing, chasing is like you inhale from the some aluminum foil. Snorting is directly inhaling it. We just have a table. Vaping is that like inhalation of vapors or aerosol of a chemical substance. For example, the e-cigarette. Sniffing or huffing is a common mode in the inhalant abuse. Whitener, Feviquick. Chasing is like a dragon, common mode of brown sugar or smack. Heating the substance over the silver foil and chasing the fume and inhaling it. Snorting is nasal insufflation. Chasing the dragon. Yes. Chase. Snorting is that powdered substance with the help of a rolled paper or thin tubes is used forcibly to inhale the through the nose. Ketamine, heroin, cocaine. Again, difficult question. We will not touch upon it. Just learn it that these are the areas from where these chemicals are coming. Dopamine come from substantia nigra. Serotonin from midline raphe Locus ceruleus giving the noradrenaline. Nucleus basalis is a source for the acetylcholine. Histamine from tuberomammary nucleus and glutamate from the prefrontal cortex. Just remember these names. From where they are coming. Now we do to one thing fastly. Othello syndrome is declarable is a delusion of love, or we know it is erotomania. Cotard is a nihilistic delusion. Magnon is a tactile hallucination. Infidelity is Othello's. Very good. Graded exposure is used in phobia. What is phobia? Phobia is a excessive and irrational fear of things not loosely feared by others and avoidance of those. 2 point in phobia that fear has to be nucleus basalis of Maynard is the acetylcholine nucleus of. It's very good. So grade exposure is useful in the phobia. Gradually exposing to the feared stimulus. Okay. So for phobia therapies are grade exposure, gradually exposing to feared stimulus, systematic desensitization means first of all relaxation, okay, relaxation and imagination of, and then mastery over every step. First, gradually you master the every step, and then is the flooding. Flooding is a supra maximal exposure. ठीक है डॉक्टर साहब. So these are the. So I was fearful of a dog, and you close me with the 10 dogs in a small room for 6-7 hours. If I remain alive for rest of my life, at least I'll be fearless of a dog. That is called flooding. This we all know. It is basically the counter transference. Psychiatrist is upset that the patient reminded him of departed father. So that's a counter transfer. Hence, emotion of therapist emotion of a patient for therapist. Well done. तो डॉक्टर साहब बहुत सारे सवाल हो गए लग रहा है. Hallucinations are seen in all except. So hallucination can be everywhere except the anxiety. LSD में तो हो ही सकते हैं. Seizures due to intracerebral SOL से हो सकते हैं. But in anxiety they do not. Okay. What is perseveration? Perseveration is a seen in the frontal lobe lesion. Okay. It's a repetition of the inappropriate repetition of same thoughts is the perseveration. Okay. Yeah, very good. Very good. Neurological causes illnesses cause more of a visual hallucination. Very good. So we have stereotyping. Repetition we have three. We have mannerism. We have perseveration. Stereotyping is repetitive non-goal directed movement is being called as stereotype. Repetitive Child is doing like this, I do this, or this, it is a stereotype. Repetitive goal directed movement is being called as mannerism. So as if some goal is happening. Somebody does this, somebody does this. So some hair has been settled up, some air has gone in. That's a this. But perseveration is a repetition beyond point of relevance in response to stimulus. Yeah. So it's a goal directed, it's a non-goal directed, and it in response to stimulus. So you ask me what is your name? I tell you my name is Mahesh, 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 Mahesh. I do not appreciate that I just told you Mahesh. One time is sufficient, but I keep on talking like that. Or I ask you what is your name? I tell you Mahesh. Where do you live? Mahesh. What is your father name? Mahesh. What work you do? Mahesh. That's a perseveration. Repetition beyond the point of relevance. Okay. Man had a fight with a neighbor. He started feeling that police are following him. Brain is controlled by radio waves, and history suggestive. It's a क्या हो रहा है इसको डॉक्टर साहब? He is suffering from a delusion of persecution. That somebody wants to kill him, somebody wants to harm him. या कुछ भी सवाल हो, मतलब पहला जवाब सही हो सकता है. यूजली पहला जवाब सही होता है. You ask my name, I tell you Mahesh. What is your father name? Mahesh. Where do you live? Mahesh. Or I can tell you what is your name. I can say you Mahesh, 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 Mahesh. If I tell you only single time that my name is Mahesh, you would have understood my name is Mahesh, but I keep on telling you like that. Okay. Thought insertion नहीं डांट साहब ये. Thought insertion में the my thoughts are being inserted. This is not my thoughts, but he is saying that police is after him. Persecution is things in they want to kill me, they want to harm him. That's a persecution. Schizophrenia, the characteristic clinical manifestation is auditory hallucination. Among that, third person auditory hallucination. Schizophrenia with a late onset and good prognosis. It's a paranoid schizophrenia. Late onset, good prognosis is paranoid schizophrenia. Sorry. Again, this is to bring to your notice the different pathways. Now, she developed the amenorrhea, decreased desire, and galactorrhea as an adverse event to the drug. Which dopamine pathway is involved in this adverse effect of the drug? Without that, it's a tuberoinfundibular pathway. We know this lead to the movement disorder, negative symptom, positive symptom. Yeah. Which is more suggestive of a organic condition. Dr. Husna Naz has told us that It's a visual hallucination which are more seen in the organic condition. So the indicator of organic condition is the visual hallucination. In psychiatric illnesses, usually we have a auditory hallucination. ये हमने कर लिया. Least likely a good prognostic factor is a premorbid personality issue. Schizoid personality is a poor prognosis in schizophrenia. Okay. All are the negative symptom except थोड़ा सा tricky सवाल. Apathy, avolition, it is one of the 4 A's of schizophrenia. Ambivalence is to do or not to do. Okay. It's a ambivalence. Ambivalence is not a negative symptom. For hypomania, we already know. This is for mania. So we try to tell you and enjoy. Well done. Well done, Dr. Naz. 7 days is mania. Hypomania is 4 days. It's hypomania. Something less than mania is hypomania. For that, the number of days required is 4 days. PTSD में सब कुछ होता है except the hallucination. So we have emotional symptom, we have repetition, and we have avoidance. 4 days hypomania. Very good. So in PTSD, we have seen all except the hallucination. GAD, they usually have the what is GAD? हर समय एंजाइटी हो रही है and they have the worries. They have the worries. ठीक है राज साहब. So it's almost 3 hours. I don't know how many questions are remaining, but still enjoying you are. Agoraphobia is commonly seen with the panic attack. We have agoraphobia with the panic attack. Agoraphobia is of two types, with panic attack or without panic attack. So classical description of the worries comes in agoraphobia, and it's a fear of places from where easy escape is not possible. Not and risk factor. We know the migration, cannabis, obstetrical complication, all are the risk factors for schizophrenia. But the no economic status, yeah, can prevent from schizophrenia. It is illness which affect the rich and poor equally. So these are genes. I don't know how much it will be required to us. This is a genetic predisposition. Monodigotic, diazotic is 15%. Child of a schizophrenic patient, 10 to 15%. Sibling is again same. That's all. Okay. Now somebody has stolen the baby from the womb. Patient has been muttering to self, not slept for 4 days. She delivered a baby. So it will be called as the postpartum psychosis. It's basically all talks are not matching with the reality. It's a postpartum psychosis. ठीक है डॉक्टर साहब, नाज साहब? Okay. Done. So I think it is too much we have done. So we know it's a classical case of a mania or a bipolar disorder. Now, in mania, in pregnancy, we know lithium is a drug which is not can be given. So we go for a haloperidol. I just write the guideline. In a mood disorder, especially the mania, for the yeah for the in pregnancy, what to be given? In lactation. In pregnancy for acute mania, we can give atypical antipsychotic or typical antipsychotic. For prophylaxis, we prefer with the lamotrigine. ठीक है जी. In lactation, all drugs are safe except lithium. As lithium cannot be metabolized, it excretes unchanged in the kidney through kidney. So infant kidney cannot excrete lithium. Infant kidney. Okay. So that's all. Acute mania, atypical or typical, but ideally we should give typical. Ideally we should give atypical, but since there is no atypical, we have to go for the choice as a haloperidol. गुड नाइट हो गया. गुड नाइट. मेरे मन के अंदर विचार डाल रहा है, निकाल रहा है. कोई बात नहीं, स्किज़ोफ्रेनिया इतनी जल्दी नहीं होता है. Affective blending is seen in very last questions coming up. कर लिया है, 10 मिनट और करते हैं, 100 हो जाएंगे. आपको भी अच्छा लगेगा, हमको भी अच्छा लगेगा. Affective blunting is schizophrenia. Emotions are being blunted fast. Lability is found in mania. What is lability? Lability is a sudden change of the mood state from one state to another. Found in mania and dementia. Okay, very good. Lability is a swing of mood, sudden change in the mood state from one state to another state. Illusionism. Illusion, we all know it's a misperception of a stimulus. Stimulus is present, कुछ तो है, but is misperceived. Very good. Okay. Perception without stimulus is being called as the hallucination. कुछ भी नहीं है, मुझे कुछ दिखाई दे रहा है, that's a hallucination. rope as a snake. Very good, Dr. Naz. बहुत अच्छा पढ़ा है आपने. सभी लोग बहुत अच्छे से पार्टिसिपेट कर रहे हैं. डॉक्टर इनसेन, डॉक्टर स्नेरुटा, डॉक्टर मोहित and everybody. Hallucination, we all know, is a disorder of the perception, and delusion is a disorder of the thought. That's a two loving MCQ of the FMG. आएगा देखिए. Visual hallucinations are seen in the organic condition. In psychiatric illnesses, we have a usually the auditory hallucination. In severe, so for the organicity, it is the visual. For severe psychiatry, it's a auditory hallucination. Okay. Synesthesia is another name for the reflex hallucination. That stimulus in one modality causes in the other modality. Hallucination. So it is found in the cannabis and LSD. I see a red color, and the moment I see red color, I start hearing a voice of friend who is in America. That's a reflex hallucination. Autoscopy is interesting. I could see myself without a mirror, and negative autoscopy is no image in mirror. तो दोनों में ही खतरनाक है. I could see myself, that's autoscopy, and I stand in front of a mirror and mirror is blank. That's a negative autoscopy. ठीक है डॉक्टर साहब. Yeah, more with LSD. Very good, doctor. Delusion is a disorder of the thought. We have discussed that. That's a division of disorder of the Othello syndrome हो चुका है. Capgras syndrome is delusion of double. Nihilism is a Cotard syndrome. D. Callerem-Bolt. Okay. Very good. That's the most loving MCQ of the FMG. We have learned fugue is a fugue is a. This question has been asked at least 10 times in the FMG exam, and for about 6 years it was the question. It was the MCQ which is available for all FMG. It's a dissociative amnesia with fugues. After there is a stressful event, there is a fight with the wife, and 10 days later I was found in Lucknow. That's a dissociative amnesia with fugue. ठीक है डॉक्टर साहब. Difficult है. It's a disorder of the content. Obsession is a disorder of the content and ego distressing. Distressing मतलब distressing. कष्ट होता है. I know I should not wash my hands again and again, but I can't hold it up. I have to wash it up. That's a It's a disorder of the content of thought, and it is ego distressing. Where कष्ट है मेरे को कि I go to temple and I'm getting a very bad thought about the God. That's a yeah. Well done, Dr. Husna Naz. So please mind no confusion. It's a difficult question. May not be asked to you, but we must know that obsession is a disorder of the content of thought, and the obsessions are always ego distressing. All of them are the. So we have learned that the as per DSM-5, no named schizophrenia. They are all obsolete. They are all obsolete. We now have a schizophrenia and Caledonia. Okay. So as per DSM-5, the names of schizophrenia has been taken away, and we only have schizophrenia and Caledonia. OCD का drug of choice is SSRI. So we know that क्या पढ़ा रहे थे? Yeah, what is schizophrenia? Two positive plus one negative symptom for 6 months is schizophrenia. Or three, two negative symptom or yeah, my God. Yeah, two negative symptom or three positive symptoms. Sorry, खत्म होने वाला डॉक्टर साहब अब हो गए. थ्री पॉजिटिव सिम्टम काफी आपको अब आते ही हैं. For 6 months is being called as schizophrenia. As per DSM-5, androgen was a severity based on the BMI, and for bulimia nervosa, severity based on the number of the inappropriate compensatory. Okay, number of the inappropriate compensatory mechanism. Hematuria. So we know these people are what they do. Fakeful production of medical symptom for getting medical attention is being called as the factitious disorder. Whereas malingering is fakeful production of medical symptom for some gain. If gain is there, it is called malingering. If only the main medical attention seeking is there, it's a factitious disorder. This lady going to doctors and asking them to get her admitted. So it's a factitious disorder. Again, it's very simple. If we have learned systematically, number of inappropriate compensatory mechanism per week. Okay. Least sexual side effect antidepressant is the metazapine and bupropion. ठीक है डॉक्टर साहब, थोड़ा फास्ट कर रहे हैं, 12 बज गए हैं. Tricyclic, they can cause death, by cardiac arrhythmia. ठीक है, well done. भी बता दिया हमने आपको. Type 2 has a associated with the cataplexy. So if we just revise the previous year's topic, so we see that many MCQ in the end are running very fast and they are getting done very easily. Okay. ठीक है डॉक्टर साहब. So we have learned that type 2 does not have the cataplexy. Cataplexy comes in only those where there is a loss of the hypocretin producing neuron in the brain. All are the indicators of the electric shock. We know that today the electric shock is being given to the catatonia, severe depression, psychotic depression, or depression with suicidal tendency. Residual schizophrenia, there is nothing point giving the electric shock. ठीक है डॉक्टर साहब. BMI 27. Weird burgers in one go and then vomited also. One go होता तो binge eating होता, but since it's a she vomit out, that's a bulimia nervosa. Tall building, looking down from very height. Phobia is suffering from is a acrophobia. These are all English words. These are all English words. Closed spaces. Nomophobia is what is nomophobia? Fear of losing mobile. ठीक है. Acro is heights. Agora is open places. But in psychiatry, nomophobia is very prevalent nowadays. Everybody is in a fear that he कहीं मोबाइल ना खो जाए, कहीं डाटा ना छूट जाए. That's a nomophobia. We know replacement is not a defense mechanism. Regression, displacement, rationalization are defense mechanisms. सवाल गलत हो गया डॉक्टर साहब, सॉरी है. Patient delirium. For delirium, treatment is low dose haloperidol. Any atypical typical antipsychotic can be used to manage the delirium. Now that's a question again. We have learned it, but asked in a question form. History of alcohol is there. There is a diplopia, ataxia, and there is a incontinence. So it will be how will you treat it? क्वेश्चन ये सारे डॉक्टर साहब मिल हो गए, दो सवाल मिल गए हैं, ये गलत है सवाल. We know it has to be given the injection thiamine. to prevent the vernicase. ठीक है डॉक्टर साहब? फास्ट फीलिंग लो, अभी ये सवाल आया. होपलेस फ्यूचर 5 साल क्या हो गया? इट विल बी recurrent depressive disorder. So it's a depressive disorder, no doubt, but it's a recurrent depressive disorder because similar episode he has 5 years back and 5 months back. So it's basically the. Thank you so much. Super short. नहीं डॉक्टर साहब. Delirium tremens treatment is the lorazepam. You give thiamine, you give dextrose, that is okay. Thiamine case is with the vernicase and corsacoves. For delirium tremens treatment is the give something like alcohol, and something like alcohol is a benzodiazepine. So it's a recurrent depressive disorder. Now he taken the metronidazole for diarrhea. He taken alcohol, so it's a disulfiram. It's a anti-abuse drug. ठीक है डॉक्टर साहब. Emergency was chest pain. 10 days ago he was robbed at a gunpoint. Doctor discharged. He is refused to go back. So it is basically a acute stress reaction. Okay. Female will be lithium. Tardive dyskinesia come by the least likely is the tardive dyskinesia. We can have hypothyroidism, we can have tremor, but tardive dyskinesia happen with the antipsychotic. Person multiple tablet of benzodiazepine. What is the antidote? Medicine question. Antidote is the flumazenil. Least weight gain will be with the chlorpromazine. Most symptom is the tremors. Yes. Now, अब बताइए डॉक्टर साहब. Man believing that his beliefs and thoughts are being controlled by external agency. It's a delusion of persecution. The precedent you can say that some. Okay, you can say that. You will do, yeah, we will say the most weight loss happens with the most common cause of weight gain, drug. So olanzapine is a drug which is most culprit for causing the weight gain. Key feature is the loss of interest in the pleasurable activity. The activities which I used to like previously, I am not able to enjoy that. Weight gain first is olanzapine, second is clozapine. Young man get a sudden irresistible urge to take action. That's a impulse. We have learned there are six impulse control disorder. Five: kleptomania, pyromania, pathological gambling, impulse control disorder, and the the skin, the trichotillomania. So sudden urge to take action. That's a impulse control disorder. Yeah. Day 5, what actually it is? It's a postpartum blues. Hypertensive episode. It will be a MAO inhibitor. It's a mono. I mean, ठीक है रट से. So this man believed that thoughts are controlled by external agency. It's a religion of persecution. बार बार आ गया सवाल. So with this we thank you. Wow, you done it. So we say thank you. थोड़ा explain भी करें. Oh my God. पहले थैंक यू करते हैं. That's why we rushly tried to cover up the topics and done a lot of explanation. थोड़ा एंड में फास्ट करना पड़ा क्योंकि 3.5 hours हो गया है. But I'm glad you are all here and you all enjoyed, and many students have been very proactive, and they have been shared their tackling stress is only one thing: the pranayam, the sun salutes, the Indian way. You do 10 minutes of Anulom Vilom pranayam and 10 sets of sun salute. Trust me, no stress will touch you. Sleep will be good, appetite will be good, attention focus will be superb. Only 10 minutes of pranayam and 10 sets of sun salute, Surya Namaskar जिसे कहते हैं. And you being a young man, I would also ask you to do 30 push-up, 30 sit-ups. You do this, stress will be chumantar. Okay. So thank you so much once again and all the very best. We'll meet you sometime very soon with the very selective MCQs. Means maybe 20-30 MCQs, and that to be predictive MCQs we'll do in psychiatry very soon. Thank you so much and good night. All the best. Good luck.